role of QEEG in diagnosis and prognosis for mental health condition, Salar already introduces me. So I work in biomedical signal processing. I basically work with EEG and ERP neuroimaging modality, and then I develop machine learning and deep learning models for that. All right, so let's go to mental health. So I think you all know that mental health is a positive state of mind, but I'll give you an example. For example, two people named Hamza and Soleh. They went to ER with acute chest pain. And they have the same background, they study at the same university, they're working at the same organization, they're living in the same area, and they are getting the same pay. One of the guy, let's say Hamza, he was given a treatment for cardiac condition, and the other guy, Saleh, he was sent back home because he's suffering from mental illness. Now, it is very important to look into mental health because the life gap for a person who is suffering from mental health is 20 years shorter as compared to the lifespan of a person who doesn't has any mental health. And this is, I'm talking about Europe, from where I'm like currently working, and in USA and in UK, the first world countries. You can imagine how bad it is in the developing countries, third world countries like Pakistan and India and other countries, even Malaysia. Malaysia is a second world country, but still it's pretty bad there. And this is indirect way of saying that people get killed because of mental illness, but there is also a direct ways. For example, suicide, Now, this doesn't stop here. Even when you are living, your life quality is greatly affected when you are suffering with a mental illness. So it is very important to look into it. And also, it is the third leading cause of disability, the mental illness, especially depression. So it's important to look into mental health and take care of it. Now, there are many factors that affect your mental health. It can be your relationships, environment, genetics, physical health, traumas, etc., etc. So in the beginning, I said that I'll be talking about EEG. So the question is, why neuroimaging is important? Why modalities such as EEG, MEG, FNIRS, fMRI are important? The thing is, how do you know unless you look? And this is very interesting that psychiatrists now, same like in 1840, when Abraham Lincoln was diagnosed with depression, they simply ask questions and guess things. They work on guesswork. But imaging is important because psychiatrists are the only medical professionals who are not looking into the organ they are treating. They are just guessing. Everyone else does. And imaging also tell us about so many things that we don't know. For example, if we talk about depression, addiction, and ADHD, there are many different types of these things which you only know when you look into the imaging. A very good example is that I saw in Malaysia that there are two people who come to a psychiatrist and they are telling the same symptoms. But when we do the EEG, they have two completely different type of brain patterns, and they have completely two different types of depression. Now, thing is, in psychiatric medicines, we called it, they come with a black box. So you give it to a wrong person and it is a recipe of disaster. So that's why we need neural imaging techniques, just to tailor made the treatment plans for the people. All right. So my focus is basically EEG. There are other modalities. Why I choose EEG, I will tell you after this video, which will explain to you how EEG works, how you can measure potential using EEG.
In the first animation, and postsynaptic potentials. In this video, we will discuss how these properties of postsynaptic potentials generate dipoles. Dipoles are defined as a separation of charge over distance and are fundamental to measuring and recording activity using EEG. Postsynaptic potentials do more than merely excite or inhibit a neuron. An excitatory postsynaptic potential, EPSP, increases the likelihood that a neuron will fire, since it is depolarizing. Or in other words, it lets positive ions flow into the cell. Alternatively, an inhibitory postsynaptic potential, IPSP, decreases the likelihood that a neuron will fire, hyperpolarizing the cell by making the membrane potential more negative. Despite whether they lead to an action potential or not, both EPSPs and IPSPs generate a separation of charge, known as a dipole. Although we have been looking at a generic neuron, EEG signals are primarily generated from a type of neuron called pyramidal neurons in the cortex. Let's walk through the EPSP here and how it creates a dipole in a pyramidal neuron. When the postsynaptic neuron receives an excitatory signal from an active axon terminal, positive ions flow into the dendrites. You can see that the intracellular space becomes more positive, rendering the extracellular space relatively more negative at the reception site. The extracellular space at the opposite end of the postsynaptic neuron is now relatively more positive compared to the extracellular space at the reception site. This pair of equal and oppositely charged poles, spanning across the distance between the dendrites and cell body, become the conduction medium for a dipole. The current flows from the positive site, source, and into the negative reception site, sink. An IPSP creates a dipole in a similar manner, but the polarity of the dipole is reversed. By understanding how dipoles are generated, we can begin to understand how EEG works.
Okay. I think this is interesting and give you a perspective.
In the first animation, we discussed how neurons.
All right. So now I talk about little bit why we need EEG and why I choose EEG over other modalities. So this is something from Wikipedia that it was first recorded in 1929. The thing is, EEG is very cost effective. It is cheap. And the second thing is it is portable. The third thing is it has a very good temporal resolution. However, the other neuroimaging modalities, they are not portable and they are very expensive. So we record MEG scans in Malaysia, and one MEG scan costs 10,000 Malaysian ringgits, which is equal to 2,500 USD. And you can buy a whole EEG machine for less than 1,000 USD. And also, since I work in preventive mental health care, so if you want to make it accessible to the people who are at homes or who are working, so EEG can be used in that regard. Other things cannot. For example, for MRI, for FNIRs, you have big machines, so someone has to come to a medical facility, you know, to get their brain scanned, stuff like that, right? Now the next thing is how EEG recorded. So you have already seen, so you have the active potential coming here over your brain, and then you have electrode placed on your scalp, and from there you can basically record the neural activity, right? So what you get from that, you get different brain waves. They are having different frequencies. So you have a delta wave, a theta wave, alpha wave, beta wave, and gamma wave, and they are activated. Like for example, if you are studying, then your alpha wave will be activated. If you are sleeping, then your gamma wave will be activated more, you know. Also, the other benefit of EEG is that it is non-invasive, which is a great advantage of this. Okay. So what is QEEG and how you analyze data which you get from EEG using QEEG? So first thing is you need to collect data. For that, you need collaborations between clinicians, scientists, and engineers. And then you identify a problem, what you work on. Currently, I am working on depression, stress, and child abuse. Then once the problem is identified, you develop an experimental design with help of a field expert, that is a psychologist. Then you seek ethical approval because humans are involved. And once all this done, then we have EEG data, which we recorded. And the data we have, it possesses some artifacts and noise. So we clean the data. And in technical terms, we called it pre-processing of the data. So the next step is, once you have that, then you extract the frequency band from the EEG, and then my work comes. So once I have this, what I do is I extract features. And this is a bit mathematical, but I try to explain it to you in a very grandma style. Maybe you guys can understand. So you can extract time-based features, frequency-based features, and time frequency-based features. Then there is connectivity features, there are microstate analysis, and there are source localization. So once you have alpha, beta, theta, gamma bands, so what you do is you take some transforms. So transforming is basically converting the signal from one state to another state. And why you do it? To get the better idea or to get the better understanding of the data. Anyone of you familiar with the term feature extraction? Anyone knows? Nope. All right. So feature extraction is basically you extract the feature which describe that thing. If I give you an example of orange. So orange has a feature, it is orange in color and it is round in shape, right? So same thing we apply on the EEG data. So we see, because it has temporal resolution and spatial resolution, so we find the things, we try to extract the thing which explain the pattern in a better way. So once you have that, then you give it to machine learning. You apply machine learning on that to classify different things. For example, if you want to classify healthy control and depression, so you first extract those features and then you give it to a machine learning algorithm which classify it to who is who. And then you can also visualize it using topo map, 2D, 3D plot, and connectivity maps. Okay. So there are many applications.
Excuse me, ma'am. Can you elaborate on the visualization part? Because I think that's quite relevant in terms of understanding the visualization part. Can you elaborate on it?
Sorry?
The visualization part, the topo maps, 2D plots. Can you elaborate on this one? Because I'm sorry.
Yeah, sure.
ML.
You want me to explain it now, or shall I finish it and then come back to it?
All right, it will be explained later on.
Yes, yes.
They said there will be a question answer session.
Right. Dr. Soyiba, let's have you complete the talk, and then anyone who has queries, they can ask it there.
Yeah, sure.
Okay. So there are many applications of QEEG in diagnosis and prognosis and treatment selection. For neurological diseases, epilepsy detection, dementia, and Alzheimer's, and for mental disorder, depression, stress, and anxiety. So I'll be talking about two examples. I'll be talking about stress and depression. And yes, there are some non-clinical applications which are very interesting. Brain-computer interface and learning enhancements. So one thing that we did like 3 years back, so we tried to control the drone using brain signals. And the person who is controlling that drone is called the pilot. So this is one of the application. And then for learning enhancement, so this is a new thing. People says that everyone has different learning style. So maybe I'm a visual learner, someone else is a audio learner. So if you can look into the brain patterns and tell who is who, it can enhance their learning capabilities. And I think this is applicable now in some of the UK universities. All right, I'm not sure, but I have read it in some article. So I'll talk about stress. So what is your favorite car, Salar? Can you hear me? Salar, right?
Solar.
What is your favorite car?
Well, I will go. How about Bugatti?
Ah, okay. So, Dr. Athar, you get a new Bugatti and you take it out on a road,
Right.
right? And something came in front of it. How
Oh
will you
no.
react?
Oh no. Okay.
All right. So, congratulations. You just experienced acute stress response, and it is called fight and flight, right? So this is what actually stress is. But it is very important to look into it because 75% of the diseases lead back to stress, right? And if you talk in medical terms, it's called homeostasis, which basically activate when you have this stress. And there are many causes which cause stress. I explain one, that is a simple example, but mainly it is workplace stress, it is stress due to some family issues, for example, death and separation, personal issues. You have some illnesses, social issues, bad neighbors, I don't know, or maybe because you're students, in your case, bad roommates, if you're sharing a room, traumatic events, natural disaster, etc., etc. Workplace stress people mostly focus on because it's frequent and normally this affect most of the people. People are mostly not happy with their jobs. But my task is just to diagnose who is who. So I'll go to that point. So you can assess stress using questionnaires, checklists, and interviews, but there is a drawback. These all are subjective measures, and probably you can give some incorrect answers. Probably you tell something which is misleading, and you also need a psychiatrist to evaluate you. But there is some advantages also. For example, it's very cost effective and it's easy to analyze. And then there are other ways to measure stress, physiological ways, right? These are objective measures, and they are actually more accurate. And you cannot make up, it's something that your brain or your body is telling. It's not like that you feel something and you inform the psychiatrist, okay, I think this is this and that's why I have stress. And the disadvantages, it needs a long time span and it is expensive to conduct. So you can measure physiological systems using different measures and modality. For example, there is a saliva test that is done to see you are stressed or not. Then you can place some ECG electrode on someone's skin and see, looking at their ECG, whether that person is stressed or not. But this is also misleading. And then you can use brain measures like EEG, fMRI, and PET scan. This is cognitive response. This is actually very good, accurate, but data acquisition is a challenge. So in existing research, as I said, the measures they use to diagnose stress are subjective. And also you need doctors or clinicians or psychiatrists to evaluate the result. And again, it's like you are throwing a dart in the dark because you are not looking into the brain patterns. So what we do is we take the EEG and we try to see who is who, what type of stress they have, or even they have stressed, or even they have stress or they do not have any stress. So there are many techniques that I have written here. They are frequency-based techniques, and then there are some time-based techniques. So you can do spectral analysis. You can take out the Fourier transform, and then you apply Walsh method. And then there are autoregressive models. And when you go to time frequency analysis, there are wavelet transforms, short time Fourier transforms. And if we look into time analysis, there is connectivity, coherence, phase lag, granular causality, so many things, but they all have some disadvantages. However, I think 4 years back, people came with a thing called microstate analysis, which is actually something which can predict stress in a very accurate manner. So what is microstate is whenever some activity happen in a brain hold it for some time, 80 to 100 milliseconds. And using EEG, we can capture that. And once you have that, you can correctly tell that that person is having a stress, what type of stress, or that person is not having a stress. But the only problem is you need to pre-process it. But we have a solution for that too. And the solution is using deep learning techniques where you do not need to pre-process the data. So you have the EEG, you give raw EEG to the pipeline, and at the end of the day, you will get the classification. Okay. The next example is major depressive disorder. So many of you will say that we have depression. But if you are smiling like me, then you do not have depression. Depressive people normally don't smile, But whenever even in my lab, when you come in the morning, people say, I think I'm depressed. Something happened. I mean, for example, you see something happen and you say, okay, I'm depressed, but you are not depressed. So I'll tell you a little bit about MDD. It can be psychotic and it can be non-psychotic. So if you look at the above graph, there is a normal fluctuation of mood. So you feel good and then you feel down. For example, you are very happy when you start hearing my presentation, but then suddenly you feel down because there is mathematics involved and you are a medical doctor. And then there is another thing. You feel low for long period of time, This is dangerous. This is alarming. You should get it checked. Then probably you have depression. Now, there are different types of depression. There is a unipolar depression, and then there is a bipolar depression, psychotic depression, postpartum depression that happens only in pregnant patients. But the most commonly illness that people have is unipolar depression. All right. So this is interesting. How you can Okay, this one, yes. How can you measure depression using EEG? So normally in clinical settings, you have 19-channel electrode cap that is placed on your head. So that's why I mentioned this cap here, and using that you can measure your EEG, and then you can see if you can analyze it and see if someone is having a depression or not. But EEG cap is not always 19 channel, it could be 32 channel, 64 channel, 128 channel, and 256 channel. And another thing is how you place the cap. You use 10-20 system or you use 10-10 system. 10-20 system is basically you take 20% of the difference of electrodes from each other. And in 10-10 system, you take 10% of the difference of electrodes from each other. Right. So the areas which are affected when you have depression is prefrontal cortex, PFC, ACC, amygdala, then insular cortex, hippocampus, basically everything, the frontal, the temporal, the parietal, everything is involved when you have depression. So what are the challenges? Why you need QEEG? Again, MDD can be misdiagnosed as bipolar if you are not manic, So if you are not jumpy and you are very stable, then probably your bipolar disorder is diagnosed as MDD. The second thing is the antidepressants that are given to the patients. They are on hit and trial method. So normally the plan is prescribed for 6 months, and then they see if after 6 months you are responding to the treatment, then they said, okay, fine, this is good for you. But if you're not responding to the treatment, then they change that treatment. So it is important to look into your brain pattern and to suggest what kind of depression you have and what kind of antidepressant you need. Okay, so this is basically a proposed scheme. So we have EEG data, and then we divide data into 2 phases, test and train. And then first we take out the features. We give those features to the classifier, and then we classify the different types of depression, and then based on that you can prescribe the treatment plan. So this is feature extraction stage. So you need to have clean EEG data pre-process, which is free from artifacts and noise. And then you can take out some features from it, like absolute power, hemisphere asymmetry, synchronization likelihood. And once you have this, you integrate those features and then you give it to the classifier. So the idea here is the more features you have, the better is the classification result, you know. So do you guys know about sensitivity and accuracy and stuff like that? Okay, so when we are designing a pipeline, we are basically looking at the sensitivity. So if the system is giving us, when we validate the system, and if it is giving us sensitivity above 95%, then we say that okay, it's a good system and it's good to go. So normally you look at the theta and alpha powers when we talk about depression, and then you look at the 2 conditions, the eye closed conditions and eye open condition. And for male patients with eye closed condition, the frontal and occipital area is affected, and for female patients it's frontal and temporal. And for alpha waves, the frontal region for male patients and temporal and occipital for female patients. Again, if you go to eye open condition, for theta waves, temporal and occipital region for male patients, and frontal, parietal and occipital for female patients. And if you look into the alpha waves, temporal and frontal brain regions for male patients, and temporal and occipital regions for female patients. So basically, female patients are more affected by depression. There is another thing that you can use that also come from EEG to diagnose depression, that is ERP, event related potential. So you give some stimulus, normally oddball, and then you look at P300 wave. So P means peak and 300 means the activity occur at 300 milliseconds. So you have this, and then you see if someone is suffering from depression, the P300 wave will be very small. And if someone is not suffering from depression, then the P300 wave will be, it has higher amplitude. And this is the example of power features. So you can also see very clearly for MDD and healthy control, the powers are very different for different bands. Okay, for asymmetry, for MDD patient in frontal region, the asymmetry of right hemisphere is more as compared to left hemisphere. And for healthy control, the asymmetry of left hemisphere is more as compared to right hemisphere. For parietal, temporal, and occipital region, the asymmetry of left hemisphere is high, and for healthy control, right. So basically, it's the opposite when you are suffering from depression, or you are not suffering from depression. So this is one of the systems that is intelligent system to diagnose depression. It was developed by Dr. Wajid in UTP, and it is for a hospital, and then they implemented it in the hospital. I will show you how it is, how it works, and probably you find it interesting. So all the feature selection and classification that I talk about is basically implemented behind this software.
Was
And
there sound in it also in that video that showed?
no, there is no sound.
Thank you.
Okay. So that's all about it. This is my contact detail in case you want to contact with me later asking anything.